So the way SIMV works is exactly the same way assist control works when the patient's not breathing. So in SIMV, I have SIMV volume, I have SIMV pressure, right? So I got those two modes again. I set a backup rate in SIMV, exactly the way I did with assist control. Meaning, if the patient doesn't take a breath, and I got it set to 12 breaths a minute, if they don't take a breath every 5 seconds, the machine is going to ventilate them. How does it ventilate them? Again, it's going to assist them with a controlled volume or pressure of 500 or the PIP of whatever I put into it. So it works identical to assist control when the patient is not breathing. Where it differs is when a patient takes a breath. Remember, with assist control, it doesn't matter who initiates the breath, it's always going to assist them with a controlled volume of what you program. So the minute volume goes up drastically. Well, with SIMV, it doesn't work that way. What it does is it's going to make sure the patient gets 12 good breaths, right, of 500 or whatever it is that I programmed it for. Anything above that the patient breathes, if the patient breathes faster than that, all it's going to do is allow the patient to get whatever amount of breath they need to get, but it's not going to help them in any way unless you add pressure support. So it's going to just simply allow the patient to do what they need. So if they take a breath and they breathe in a full breath of 500, so be it. If they take in a breath of only 50 cc's, no big deal. What that does is it allows your patient's compensatory mechanisms to work a little bit more effectively. So if they start to retain a little bit of CO2, they can breathe a little faster and blow it off. If they start to hyperventilate and they're just gasping for air, it's not going to change their minute volume significantly because they're not moving that much air. So with somebody who is hyperventilating or breathing erratically, SIMV is a much better mode of ventilation because it allows the body to compensate naturally, versus assist control won't let them do that. So it doesn't allow them to compensate as well as SIMV would. So SIMV is better for somebody who is breathing erratically or breathing really quickly.